Hi, I'm Leanne.
And I am Kevin.
We are students at Sanford College in Atlanta studying cardiovascular sonography. Today, in this video, we are going to talk about systolic function and dysfunction. When the heart is in systole, the heart contracts to pump blood throughout the body. To figure out how well the heart is pumping, we use an echocardiograph. This allows us to examine the heart in a 2D plane. From this view, we can take measurements to determine how efficiently the heart is pumping. This is called the ejection fraction. The ejection fraction is the percent of blood that is squeezed out of the ventricle with each beat. The normal ejection fraction is above 50%. The measurements that we take in 2D systole are the left ventricular inner diameter, the intraventricular septum, and the left ventricular posterior wall. These numbers are compared to the same measurements in diastole to give us the ejection fraction. There is another method of measuring the ejection fraction. It's called the Simpson's method. The Simpson's method is most accurate, but is more time-consuming. In this method, we use the apical 4 view and trace the outline of the ventricle in both diastole and systole. After the trace is complete, 20 equally spaced lines are drawn by the computer to give us a more complete measurement of the ventricle. The two stages of the cardiac cycle are then compared and we get our ejection fraction.
Having an ejection fraction less than 50% is considered abnormal in systolic dysfunction. Risk factors for accumulating systolic dysfunction include having a family history of cardiac, heart failure, or coronary artery disease, poor diet, and lack of exercise. The symptoms of systolic dysfunction are shortness of breath, decreased cardiac output, which will feel like fatigue, and edema in the lower extremities. The most common cause of systolic dysfunction is coronary artery disease. Hypertension and congestive heart failure also are known causes. For an individual who has systolic dysfunction, the treatment would be an ACE inhibitor, which is angiotensin-converting enzymes, followed by diuretics and a digitalis, which strengthens the contraction ability of the heart. In closing, we hope this has been an effective explanation of systolic function and dysfunction.